Thank you so much. It's such a pleasure to be here this morning. And really thank you to all of our participants online for joining us for such an important series. So she said, I'm Nancy Eslick. I'm USAID's Global Water Coordinator, and I am thrilled to be joining you this morning. I also just want to take a second and say how grateful I am to our co-hosts and collaborators for working with us on this important data collection series. And that's the Rural Water Supply Network and the Millennium Water Alliance. So thank you so much to both of them. Shout outs to you guys. The Quarterly WASH Data Clinic series is part of USAID's efforts to support better decision making for water and sanitation programs by using data. Importantly, it's about socializing the vast sector data that's already available at our fingertips, showing how and when we can use the data to strengthen all of our programs. Every quarter, USAID and our partners in this effort will be sharing widely available data sets that will help us reach people more efficiently and equitably. The Data Clinic today is a perfect start for this series. One of the most effective ways to improve efficiency and equity is to better target our activities. One of the hardest parts of targeting has been finding those individuals that have been left behind. These are often marginalized groups that have been left out of decision-making processes or excluded from the systems that allow them to advocate for themselves. As a result, these are the hardest groups to be able to locate, and they've not shown up on maps until now. Working with the Demographic and Health Survey Program, USAID's investment in the WASH Atlas is providing maps that pinpoint exactly where these people are being left behind. While we know that decisions about targeting are not made entirely based on data, we also know that accelerating sector progress requires bringing more data into the decision-making process. Data-driven decision-making is no longer optional. The scale of the challenge is simply too big, and the financial resources are too small. So thank you again for everyone joining us, whether it's this morning, this afternoon, or this evening. I'm pleased to now hand it over to Dr. Katie Sill, who's our Chief of Party for the USAID Water Security, Sanitation, and Hygiene Data and Analytics activity. Over to you, Dr. Sill.
All right. Thank you so much, Nancy. I hope everyone is doing well in their various parts of the world. It's bright and early here in Colorado, where I'm based. My name is Katie Sill, and I'm the Chief of Party for the USAID Water, Sanitation, and Hygiene Data and Analytics activity, which we typically just call WASH DNA. WASH DNA is implemented by Segura, with consortium members from ACFO, Encompass, ITAD, and Tetra Tech. And it's a unique activity that reflects this commitment from USAID to invest in new and innovative efforts to help accelerate progress towards reaching SDG 6 and help improve the efficiency and equity of services. The activity has 4 main objectives. The first is to strengthen the WASH data landscape through research, communications, and support to digital public goods through data sharing and a small grants program. The second objective is to support data-informed decisions through the development of new decision support tools. And a quick heads up that we will be doing a soft launch of our first tool, the WASH Futures Explorer, in just the next few weeks. Keep your eyes out on LinkedIn through Global Waters for more updates soon. Under this objective, we also aim to provide support on existing tools through things like today's webinar event. Our third objective is to monitor WASH service acceleration resulting from USAID's systems strengthening work to better understand how systems work impacts water and sanitation service users beyond these direct investment areas. And our final objective is to provide tailored evidence-informed decision support on specific scopes of work for USAID operating units and missions. Today's webinar directly supports our first 2 objectives, and we are very excited to launch this series in partnership with RWSN's Data for Action initiative and in collaboration with the Millennium Water Alliance and USAID's Pro-WASH and Scale activity. This new quarterly data clinic webinar series is meant to be a little bit different. It's meant to focus on very practical ways of using data to answer key questions and support evidence-informed decision-making. We're aiming to fill that gap between having awareness of a tool and being able to actually use it to answer a specific question or make a specific decision. This is our first one, and we are very eager to hear from all of you regarding the topics, tools, and decisions that you would like to see featured in future sessions. Please provide your inputs in the polls that we share today, but also feel free to reach out after the webinar with additional ideas. Today, this first data clinic will feature the DHS WASH Atlas. This tool, launched earlier this year, is the first large-scale subnational dataset on WASH services. In discussions with stakeholders, one of the most frequently mentioned challenges or questions is around access levels at the subnational scale to support planning efforts and to determine where new programs should be targeted. By the end of today's session, we hope that all of you feel ready to go to this tool, to use it, and integrate these results into your decision-making process. I'll now pass to my colleague, Muthi Nama with Baseflow in Malawi, and he's also the theme lead for RWSN Data for Action Theme Group. Over to you, Muthi.
Thank you, Katie. Good afternoon, good morning, good evening, or good night, wherever you are. Yes, as mentioned, my name is Muthi Khema. I am the theme lead for the Data for Action thematic group, one of about 6 thematic groups within the Rural Water Supply Network. So I'll do a very quick introduction to what RWSN is. It is a global network organization of about 16,000 members spanning 170 countries. And all of these professionals and all of these organizations are focused on trying to improve rural water supply so that we can ensure that people enjoy safely managed water services. Now, a lot of this is achieved through 3 key avenues, and that is networking and connecting and convening, knowledge brokering and information hubs, but also training and development of guidelines and standards. So as a network, we try to engage our 16,000 member network in these 3 different avenues. As I mentioned, there are quite a number of thematic groups that we have within RWSN. We have sustainable groundwater development, sustainable services, water quality, multiple uses, and of course, self-supply. So these are sort of the larger thematic groups, and the cross-cutting groups are Data for Action, of which I'm the theme lead, together with my co-lead, Mutala, who's on the call here, as well as the Leave No One Behind. So each of these thematic areas tackles a specific issue that is integral to that particular theme. Now, the group that I'm a part of is the Data for Action group. It used to be called the Monitoring and Mapping group, but we changed the name to Data for Action. And this is linked to a lot of what Nancy said a little earlier, as well as Katie. It's not just about having data or having the information, but it's like, how do we use that information? So around 2 years ago, we changed the name from Monitoring and Mapping to Data for Action, because it's really about having the data and trying to use it to make decisions. And I want to quote something Nancy said a little earlier: data-driven decision-making is not optional. It is now the status quo. It's something we cannot avoid. And that is why data clinics like this one, WASH data clinics like this one, are very important to RWSN, because webinars are important. Webinars are of course, crucial to sharing as well as networking and convening as one of our thematic areas or strategic areas. But for us, it's more about what more can we do? So as Katie has said, I'm very excited to see how this session will go, particularly the office hours that will happen afterwards, where we'll actually get those of you who want more detailed, who want to go into it in depth, can actually engage with the presenter. So I'm actually really excited about the rest of this webinar, but also the office hours, which will take place at the top of the hour. So thank you very much. That's RWSN. I'll drop in the chat those of you who'd like to be members of RWSN or any of the thematic groups. I'll drop the email the website address in the chat so you can actually access the email address so that you can actually engage and join whichever group you'd like to join, hopefully Data for Action. On that note, thank you very much. If we can move to the next slide. So after all of the speeches that we've made, now we come to the reason why we're all here. The presentation on WASH Atlas, which will be given to us by Dr. Ben Mayala. Now, who is Dr. Ben Mayala? I'll just do a very quick introduction. Dr. Ben Mayala is an experienced geospatial and climate science professional with over 18 years experience in applying geospatial analysis methods in the health, environmental, and socioeconomic sectors, even working for the CDC and the World Health Organization. Currently, he serves as the Senior Geospatial Advisor for the DHS program, where he oversees a geospatial team and leads projects focused on implementing advanced geospatial modeling and machine learning techniques. Dr. Mayala holds a PhD in biological sciences from the University of Notre Dame, specializing in geospatial science. And just something other than work-related, he enjoys running, especially in the winter. Apparently, he thrives in the winter, and that seems to be his hidden talent. On that note, I hand over to Ben to take us through the WASH Atlas, the tool that we are all here to learn about and see how it is used. Over to you, Ben.
Yeah, thank you. So before we dive into the WASH Atlas, I want to provide a quick overview of the DHS program. So the DHS program is funded by United States Agency for International Development to provide technical assistance in the collection and the use of data. The DHS program provides data to monitor and evaluate population health and then nutrition programs. So the DHS program is mostly widely known for the demographic and health surveys. These are nationally representative household surveys with large sample sizes. We collect data on a variety of health and demographic indicators, and most DHS surveys are collected about every 5 years. So this map here highlights the countries where we have conducted DHS surveys. So now let's dive into the WASH Atlas. The WASH Atlas is a collection of modeled subnational estimates for key WASH indicators and is part of the local data mapping tool on the DHS program Spatial Data Repository. The tool allows users to visualize and interact with modeled subnational estimates, providing valuable insights into the subnational variations. DHS program surveys are generally designed to produce a large administrative division within a country, referred to as Admin 1. However, with growing demand for estimates at lower subnational levels, we utilize a geospatial modeling approach to estimate indicators for 5 by 5 kilometer pixels, or we say resolution. These estimates are then aggregated to the second largest administrative boundaries within a country, referred to as Admin 2. The geospatial modeling approach incorporates the spatial relationship between survey clusters and the relationship with external dataset, including temperature, population, and socioeconomic variables to help estimate indicators at these lower subnational levels. The WASH Atlas is a collection of modeled estimates for 4 key WASH indicators for 10 recent DHS surveys in 9 countries. The 4 WASH indicators are population without basic water service, population using open defecation, population without basic sanitation service, and population without improved water source on their premises. Currently, modeled estimates for these 4 key indicators are available for 10 surveys in 9 countries, shown here. We plan to add modeled estimates for 8 additional surveys, shown here, and this modeled estimate should be available added to the WASH Atlas on the Special Data Repository in 2025. The WASH Atlas helps solve many critical data gaps. The WASH Atlas includes estimates from the most recent DHS surveys, which are generally collected every 5 years, as I said. In some cases, such as Madagascar, the DHS surveys were conducted more recently than the country census. Also, the same indicators are estimated for the available countries, and also the WASH Atlas estimates can be visualized in maps, tables, and charts on the local data mapping tool. So I'm using the same LDMT. The estimates can be easily downloaded and is available in several formats to meet user needs. The WASH Atlas provide estimates at the admin 2 level. Data from other sources is not always available at this level. Also, not all recent countries census use STG WASH indicators, as some still use improved or unimproved indicators. We'll now show you how to navigate the tool. From the drop-down in the upper left, you can select any survey which has modeled estimate available. From the drop-down in the upper right, you can select an indicator which has modeled estimates available for the survey you selected. Users can toggle between 3 subnational levels, the admin 1, admin 2, and the 5x5 kilometer. Admin 1 shown here has the subnational DHS estimates that are available on the SAT compiler and the final reports. If you select admin 2, you will see the modeled admin 2 boundaries and estimates. Selecting 5x5 kilometer, you will display the modeled estimates at the 5x5 kilometer scale. Users can also select between 3 metrics for the modeled admin 2 and 5x5 kilometer estimates. Here we see modeled admin 2 estimates, which represent the percentage of the population. Users can interact with the map. For example, we'll select admin 2 to display all the relevant metrics for the area. If the population matrix is selected, the map will change to show the population affected for each admin 2. Selecting the uncertainty metric will switch the map to display the width of uncertainty interval associated with the percentage estimates, which is the difference between the upper and the lower bounds. The default view in the tool is the map view, where you can see the map visualized at the subnational level selected. However, there are 2 other visualization options available in the tool. Users can switch to the table view for the admin 1 and admin 2 levels. In the table view for admin 2, all relevant metrics are displayed, including estimates, uncertainty, and the population metrics. Users can sort the table indicator. Here we'll sort the table 2 estimates from low to high. Clicking again, it will sort from high to low. Users can also switch to the chart view, where estimates are visualized as bar with error bars showing the uncertainty for each estimate. If a user wants to focus only on a particular admin 1, they can choose the admin 1 in the select level option. Here we'll choose the northern admin 1 And they will see the bar chart now only shown admin 2 estimates in northern admin 1. Users can download all the data by clicking the download button in the top right of the tool. The download button will download data for all the indicators for the selected surveys. A zipped folder is downloaded which contains the following data. 2 tables are available in the download package. One table with the admin 1 estimate and another table with the admin 2 modeled estimate, population and uncertainty metrics. Shapefile for users with GIS experience, a shapefile is available that contains the boundaries and all the relevant metrics that can be mapped in any GIS softwares. There are also raster images. These are file are provided for the 5x5 kilometer modeled estimate, uncertainty, and the population affected. The documentation, the downloaded package contains a general document on using admin 2 estimate and a specific document describing the modeling approach for the WASH indicators. Additionally, a text file is available which describes the naming convention used in the download file, tables, and shapefile. So now let's say you are responding to a request for proposal from the USAID Zambia mission to select locations for drinking water program. The WASH Atlas can help you identify the top locations for considerations based on the available data. The 2 major objectives for this case study are to practice using admin 2 level modeled estimates and compare modeled estimates to population figures to maximize the potential impact of intervention. We'll start by selecting the Zambia 2018 DHS and looking at the admin 1 data for the indicator population without basic water service. Remember that these admin 1 data are directly survey estimates. They match the figures you can see in the final report tables. Also remember that basic water service is defined as an improved water source with either water on the premises or round-trip collection from a collection time of 30 minutes or less. In this atlas, we are looking at those without basic water service. So a high number is a cause for concern. In this admin 1 map, we can see the northern and western province in the red color, indicating they have the highest percentage of the population without access to basic water service. However, we want to explore the admin 2 maps to see if there is more variation underlying these estimates. While in northern and western province are the only admin 1s in the red color, indicating over 54% of population is without basic water service. When we switch to the admin 2 level, we now see main admin 2 in red outside of those 2 provinces. When we compare the 2 together, which you can do in the tool by toggling between admin 1 and admin 2, here we see that there are admin 2 in the red color in lower burden admin 1, including Central Province, Northwestern Province, and in Luapala and the Mochinga provinces. The admin 2 level map is helping us to see that there are additional areas for potential focus beyond what the admin 1 data showed. When considering the estimate, you should also consider the uncertainty associated with the estimates. On the tool, you can visualize the width of the 95% uncertainty interval, which is the upper bound minus the lower bound. Admin tools with high uncertainty with have great uncertainty should be used with caution. Here we see that one of the admin tools, Chavuma, has uncertainty width of 26. When we click in the district, we see more details. Here we see that the modeled estimate is 53%, and we are 95% confidence that the true value of this admin tool lies within the uncertainty range, and which is 40 to 66, which represent a width of 26. In some cases, admin tools with high uncertainty may have lower population counts, which we'll discuss in the following slides. At the admin tool level, the mode uncertainty is a function of several factors, including data availability. This graphic shows survey clusters from the 2018 Zambia DHS, where each cluster is colored by the proportion of respondents without basic water service. In general, because smaller districts tend to have fewer survey clusters in the DHS, the modeled estimates for those districts will usually be more uncertain. This image is not available through the tool, but was added to help explain uncertainty. So to better explore and compare, click on the table view and sort the results by admin 2 estimates. This view now shows the bottom of a ranked list of admin 2s based on the percentage of people without basic water access. The top 10 admin 2s are in the western, which we see there like 5, northern is 3, and the lower Pala 2, all of which have greater than 69% of population without access. When evaluating district rankings, you may want to seek additional evidence for the district with wide uncertainty. The uncertainty width column, highlighted in yellow, shows the difference between the lower and upper bounds of the 95 uncertainty interval, as I said before. On this list, we see the link that Ikalenge has the highest uncertainty width of 30% points, indicating that the true value could be within a 30 percentage point range. From the table, we see that while the estimate is 57%, the true value could lie between 41 and 71%. So because that range is fairly wide, you may want to supplement the DHS district estimates with outside evidence, such as local studies or data on related indicators, to determine whether the proportion of people without basic water access is more likely to be near the bottom or top of that range. Additionally, you may want to consider any major interventions or events that could have affected district rankings since the DHS data was collected. While this case study has a maximum uncertainty width of 30%, the uncertainty width for other indicators can be higher. So uncertainty should always be considered when using these estimates. So another way to try to prioritize your list of admin 2 areas for intervention is to consider these uncertainty bounds. You can do this by ranking your admin areas by lower or upper uncertainty bounds instead of by modeled estimates. So sorting by the lower bound ensures that we are confident that the admin 2s in this list have a higher probability of needing intervention. Districts with a very high estimate but also very wide uncertainty interval may appear in the estimate list, but not this list. In this Zambia example, we rank by lower bounds. Our top 10 list did not change. The same areas appear on this list, although a slightly different order. That's what we see there. So while this high percentage without access to basic water service are concerning, we also have to consider how many people live. That is, how many people are living without access to basic water services. Some districts in Zambia are very heavily populated, while others are less populated. On the tool, users can visualize the population count affected at the admin 2 level. In this example, the values represent the total number of people in each admin 2 who are estimated to lack basic water service. When we compare the population affected map with the percentage estimate map, we see different patterns. This is due to the variation in total population in each admin 2. For some admin 2s with a very high total population, a low percent estimate could still result in a relatively high population affected count. Similarly, in a very rural area, a high percentage estimate could still result in a relatively low population affected count due to very few people living in that admin 2. So users may want to focus on a particular metric depending on their use case. The population affected map can help to determine where the greatest number of people need service. This might be a more useful metric for infrastructure-focused activity, seeking to reach the greatest number of unserved population. On the other hand, the percent estimate can help figure out the extent to which the government is providing services, regardless of population. So this might be more relevant for governance activity. The table also includes a column for population affected, the second column from the right. When we sort by the population affected, here we see that the admin 2s within the highest burden changes. For example, despite Lusaka having a very low estimate overall of only 8%, because it is very high, because it has a very high total population count, the population affected in Lusaka still exceeds the population affected in the admin 2s in Western Province with a markedly high admin 2% estimate. These are more the extreme cases, however, and we still see that many of the admin 2s with a high percent affected also have high total population affected. Particularly, we see here Mpulungu has 72% estimate, and Mungwi with a percent estimate of 64. So as a reminder, uncertainty applies here too. If the uncertainty width is very wide, remember to check other sources if you can. You also note that there is an option to view this data at an even smaller level, a 5 by 5 kilometer square. These data are only accessible through the map view. As seen with the admin 2 uncertain bounds, estimating at lower subnational levels increases uncertainty. While this view can provide a bit more sense of the variation throughout the country, it should be interpreted with caution. So admin 2 estimates are essential for decision making as they help identify wash services disparities and the resource needs within specific region. By utilizing this data, we can inform targeted interventions and allocate resources more effectively. However, it is important to remember that this estimate should be viewed as just one piece of evidence in decision-making process, complemented by other data sources and the local knowledge. So to conclude, while admin 2 WASH Atlas estimates have uncertainty, these 8 estimates provide valuable insight in and help to solve many critical data gaps by providing recent, consistent, easy to access, high resolution, and STG-linked data. Given the uncertainty, it is crucial to use them responsibly in the decision-making process, as I said before. In this case, where there is high uncertainty, users should not rely only on the admin 2 data, but consider it alongside the local studies, such as the Health Management Information System or HMIS records, or data on related indicators. So this holistic approach ensures that we make informed decisions that accurately reflect the complex of the local context. So thank you for listening, and here you can find my contact. Thank you.
Thank you very much, Ben, for that presentation. You've got my mind buzzing right now, Ben. And I'm sure, I don't know if you noticed, you've got other people's minds are buzzing as well. We've got quite a number of questions in the Q&A already. So for those of you who are just who have been posting in the chat, please post in the Q&A. We'll take some of your questions and pose them to Ben. But just to provide a very quick overview of the wonderful and amazing presentation. And I'm a data geek, so seeing those numbers actually excited me. And one of the things about the presentation, just to give a quick overview, is that the WASH Atlas is responding to a growing demand for more lower level or subnational data. So data that's actually at a sub level, so that that information could actually be used for more accurate targeting. And I think this links very closely to what Nancy spoke about at the beginning, where we really want to reach those people who are missed out in our targeting. So having subnational data helps with that in theory. And the WASH Atlas actually helps visualize that data, not only at the national, but also at subnational. And it even goes further to a 5 kilometer by 5 kilometer grid. So this platform is actually responding to that need. Also, some other elements that I picked up during the presentation, they already have a number of data sets from about 9 countries, about 10 surveys. We got to see the Zambia survey from 2018. And some of the analysis can actually be broken down to many administrative levels. So you've got level 1, which would be a district level. Then you've got a sub-district level. And then you go further to a 5 by 5 grid of analysis. So those are the levels of analysis that this particular platform can provide. And of course, there are so many levels of visualization. So you can look at it as a map, you can look at it in a tabular format, but also as a chart with varying levels of uncertainty. And I think the one image that I really liked, Ben, was the comparison you did between, I think it was the 2018 Zambia data analysis, where you're looking at it at admin 1 and comparing it with admin 2, and how a decision maker looking at these things will make completely different decisions in terms of where they would target, looking at the granularity of the data that's available. So that one really got to me. And I found that really exciting. And Ben continued talking about this and looking at, yes, you can have the different levels of analysis, but you need to be cautious of uncertainty. And he spent a bit of time on that as you get lower and lower. Oh, thank you, Ben. You could probably share the screen. Yes. So this was the chart that I really liked. You can see that admin 1 and admin 2. So admin 1 is sort of your district level, and admin 2 is your sub-district level, depending on where you're from. In some countries, you say provinces, counties. So it's at different levels of analysis. So if you look at admin 1, the decisions that a decision maker would make with admin 1, looking at population without basic water service, will be different compared to admin 2. Could you click again, Ben? You showed some arrows in the middle of your presentation. Because if you notice, when he clicked on the arrows, there were certain segments of areas that looked like they did not need support. Thank you, Ben. But actually, if you look at it at an admin 2 level, actually they do need support. But if you use admin 1 as a decision maker, you might say that district does not need any investment or support. So this is a very powerful visualization that can actually help with decision making. Thank you, Ben. And just very quickly, because I really want to get to questions, there's a lot of excellent questions here. Something else that the presentation touched on was looking at, if you are going to use admin 2, you have the visualization will produce different results if you're looking at population in terms of reach, in terms of people without water or access to basic water services, and the proportion or the percentage estimate of how many people do not have access to water services. And depending on which one you use, there are variances, and each one can be used for different use cases. I believe, Ben, you said if you're looking at the proportion, if you're using population in terms of number of people, that would probably be useful for infrastructure investments. While for an estimate, if you're using percentages, that could actually help you in terms of where government investment needs to be increased. So it can inform where government is actually providing services or not. So the use cases for those two things is very different. And actually, I found that quite interesting because I just assumed they would speak to each other. But that's actually interesting that they are used for different things. And thanks again, Ben, for sharing. You can go down to, yes, this is the particular slide. So you can actually see the population one is for level 2 is showing a different one for estimates. And a decision maker will use each one for a different use case. So I'm sure people will have a lot more questions there. And in closing, I think if I could summarize this in this way, the more granular the data, the more uncertainty associated with that information. And it's important that you use the data responsibly. And Ben emphasized that it's still important that you combine the WASH Atlas data, especially at admin 2, with other data sources to sort of fact check it where possible, especially where the uncertainty is quite high within the data set. So that's just a quick summary of some of the stuff that Ben touched on. And Ben, like I said, you got me excited and you've got other people excited. I'll jump to some of the questions here. That I'll start with something that's a little lightweight and then we'll move to some other questions. There's a question here from Tess O'Hara. I hope I pronounced it correctly. Or O'Hara. I hope I pronounced it correctly. She's asking, Ben, I'd be really interested to hear. Oh, no. Actually, Tess, I'll come to you shortly. Frederick asks a very basic question, but I think it's important. He's asking, Frederick says, I'm a little confused. How is this data better or different than or from the JMP data? So that's Frederick's question. So I think we'll start, okay, I'll take two questions, then you can respond to those, Ben. So the first one is, how different is this from the JMP? Tess asks, I'd be really interested to hear how programs can contribute to data updates to help keep the map current, and what metadata can be explored for validation purposes. I think the second part you spoke to it towards the end of your presentation, but you can just maybe speak to it anyway. So how different is this from the JMP? And also, how can programs, I'm assuming NGO programs, contribute to data updates, and what other metadata can be explored for validation purposes? Over to you, Ben. Those two questions. What are your responses? Thank you.
Yeah, thank you so much. The first one, please elaborate what is JMP for me. I think I don't want to. To say.
But
okay, let me respond to the second one quickly. So the second question, yes, I think we have done some work whereby we have incorporated different data set. So I think the idea of programs contributing data, that would be great. So what we've been doing here at the DHS program, we use the data that we have collected. As you know, like we go to countries, collect the data, and then produce the different estimates at the regional level or admin one level. So we're trying to go now to lower level. But I think, for specific need or request, if like a country say, oh, we have some other data set that we want to combine with the DHS data, so that we can see how like how you can model, you can produce model estimates at a lower level. So that's something that can be done. But there are so many things, that we need to take into consideration, like the way how we do the surveys, do you have GPS locations? Are we using the same indicator as the one we have in the DHS surveys? So those are the things that you need to take into account. But yes, we can use other data set. So let's go back to JMP.
JMP, it's short for the Joint Monitoring Program for UNICEF and WHO. It's a set of WASH indicators that we are all contributing to track progress. And actually, some of what you're presenting touches on some of those indicators. But if you're not aware of it, we can just move to another question. There are quite a number of questions, and we're running a bit out of time, but I want to pick. Okay, there's a question here which is a bit political, but I'll try and simplify it. Given the environment given a political environment where governments want to be more popular and they're more taken up by popular ideas, in the work that you have done so far with this data set, have you seen a willingness by decision makers, particularly of the political class, to engage with this kind of information? Or are they still drifting towards more popular ideas or things that are more popular instead of data-driven, especially with this kind of information? Can you probably speak to that in terms of engagement from decision makers with this kind of data set? Have you seen a willingness to engage, even if the data is not necessarily popular?
Yeah, thank you so much. Yes, I mean, when you mentioned the politics. So I think let's go to the stakeholders. So what we do at the DHS, we produce estimates for so many indicators. So not only WASH. So recently we did and also we're able to engage, our countries, stakeholders in countries, and we see that there's a need, and also there's they use this information for decision making. So I think the point here comes like when people they see the value, and we have seen that, like people they see there's value at the admin 2 level estimates, especially when you want to target intervention, when you want to do some planning, which areas specifically should focus. That's where people see the value. But again, if you present something that is not good for the country, the country seems that, oh, this is not showing a good image for us. We haven't faced that kind of challenge, but I think, things can be explained, come to the, explain things, make them understand so that we're all on the same page. Because what the message here is the value of this tool, or the value of this data set, how this can help the country, instead of you just looking into your side like, oh, I don't want my country to be seen as like a bad image because of, we're seeing things are not improved. No, but I think how can you use this data set to make things, to improve things in your country? Thank you.
Yeah. So to try and tailor it more positively rather than negatively in terms of the messaging. Because of time, I just want to encourage everyone that we're going to have office hours after this main portion of the webinar. So the office hours are for those who would like to have more in-depth conversations, technical conversations with Ben regarding his tool. And we're going to look at sanitation. There was a question asking, can you use the data for the WASH Atlas for sanitation? Yes, and during office hours, we're going to look at that. Ben, Like I said, there are many questions here, and maybe Ben, if you can put up the slide, the last slide with your email address on it. For those of you who've asked your questions, because of time, I can't get through all of them, but Ben will share his email address, and you can email him directly if you would like to have more conversations. He even posted his email address in the chat, so you can post Ben. You can post your email address in the chat or share as he's doing right now. Maybe as the slide is up, I have one last question for you, Ben, for the sake of everyone here, because there are questions here about uncertainty and how that impacts the quality of the data. My question to you is, are you planning any improvements to your WASH Atlas in future? Any planned improvements to deal with some of these elements that you said we should be cautious about?
Yes, definitely. We have some plans, of trying to see, how we can improve our modeling techniques, maybe adding some more machine learning approach, technique algorithm into the model, or trying to use other, we call geospatial covariates that are more related to the outcome that we're trying to model. Yeah, so there are a lot of plans for improvement, but I think what we have presented so far is looking good. And of course, one thing that I've been telling people, there are some indicators that they're like very complex, very complicated to model. So one of them basically the WASH indicators, because sometimes you get high percentage of, let's say if we say people with the basic water service, you're gonna get a lot of, high percentages, but yes, there's some improvement, and we'll be glad, I think, to share in the future.
And looking forward to those improvements. Thank you very much, Ben.